Hello to everybody, and welcome to this new appointment with the NIRVANA clinical webinar. And today I'm very glad to stay with Dr. Luca Doglio, who is a specialist in physical medicine and rehabilitation here in the Pediatric Hospital of Gaslini in Genoa, one of the most important hospitals here in Italy in the treatment of children with various pathologies. Today he's going to explain us his experience with the NIRVANA system in the treatment of motor and cognitive disabilities of the developmental age. So thank you very much to this opportunity, and you can start your presentation.
First of all, good afternoon, and I'm very pleased to stay here. Approximately we started 1 year ago with NIRVANA. What is this NIRVANA? It's an immersive virtual reality system. Is useful for motor and cognitive rehabilitation of children, not only of children, but of course we are a pediatric hospital, so a lot of our patients is children, of course. Children of different age, of course, but children, what kind of problem we are used to treat. Of course, problem of development, for example, problem of learning, CP, and this system, thanks to an active involvement of the patient, it speeds up to a whole rehabilitation process. Okay, okay. Probably is for us is a good instrument, a good device, because it does not require to wear any sensor. Of course, patient can use his device, for example, wheelchair or orthosis, but the patient is free to move in an ambient, in a sort of room in which we are use the system. The patient, it's fundamental, this concept, is a protagonist of his treatment, and with exists a sort of feedback that gratifies his commitment and leads to him to improve. Of course, we have a system that is able to permit us to emotion analysis, and the doctor or the therapist is able to adapt the different level of difficulty and create a specific program for each patient. Which are the most important therapeutic benefits? Of course, from the motor recovery point of view, coordination, motor control, balance, trunk control, visual, spatial, and constructive abilities, and a sort of increases of muscle strength. From the cognitive point of view, we have the active participation, concentration, attention, memory, visual perception, and social interaction. which patient? It's difficult to understand what is the specific pathologies. But we can create sort of a list of the most important pathologies. So brain disorders, for example, spinal cord injury, CP, disorder of physical and mental development, autism or spectrum disorders, learning disorders, delay or difficulty in coordination, hyperactivity, and problem of attention, of psychomotor inhibition, or, for example, orthopedic impairments or genetic disorder. Some patient of us is with Down syndrome, for example. It is a game-based treatment. So it's create a cognitive and perceptive participation. It simulates and stimulates attention. It improves hand-eye coordination movement. It improves balance. It increases physical strength, and it improves manual tasks. It simplifies motor development, and it improves the emotional state and reduce stress and anxiety. This is an example of our patients. So I repeat, but it's very important. It's increased child's attention and motivation during the session. It's improved motor control and eye-hand coordination. It develops a self-confidence and enriching child imagination and emotional intelligence. And it improves social interaction with with different babies or with the babies and the therapist. And it strengthens the learning. It's a sort of efficient and enjoyable method of rehabilitation. And children are wishful to do again the treatment and introduce the concept of functional play in pediatric neurorehabilitation. And multisensory stimulation can be considered as a reward for the child after traditional physiotherapy session, for example. This is a sort of list of 15 patients who tried the system. The age, the younger is of 3 years, a baby of 3 years, and the older is 17. The kind of pathologies are different, but first of all, we have 1, 2, 3, 4, 5, 6, 7, 8, 9 patients with cerebral palsy, and with 1 patient with achondroplasia, or 2 patients with polymalformation syndrome, and 1 patient of hemiparesis, but from caused by a stroke. So the great number is the cerebral palsy, but I try to stress that that doesn't exist a particular or specific categories. Okay, is a system that is open, so doesn't exist of a sort of contraindication for the treatment. We use 6 different types of exercise, and we assign specific goals for each patient, and we have a form to collect data and we describe the performance we verify the correct performance of exercise and the data that are available for analysis. This kind of exercise, the exercise, for example, we ask the patient to bring the black sheep and bring the black sheep into the fence. So there is a motor ability, of course, but cognitive ability to recognize the black sheep. Then, for example, in this experiment, we asked to this baby to bring in a supermarket what mom signs in the shopping list. For example, in this case, baby is not able to walk and she uses a wheelchair, for example, but it's not important because the baby is able to do in a fantastic way the exercise. For example, this is a cause-effect exercise. So patient can use the cord to a sort of play of guitar, for example. And in this case is another type of effort exercise. And maybe in this case, we asked the baby to recognize the red balloon, and then they to explode only the red balloon. So the baby is necessary that she's able to move in the ambient and of course recognize. So from A and cognitive and then motor, of course. We divided in 3 categories patient. The most not important, but the high number is in the category of from 5 to 10 years old, of course. We have patients over 11 and 5 patients under 5 and over 4. The task is understanding in a completely, of course, in the patient older, in the 70%, 71% in the category of 5 to 10, and only 60% in the category from 3 to 5. Is useful in 60, 71, and 66. And the data the data of appreciation is 80, 85 in the younger category, and only in the 66 in the older. Then after we analyze this data. Motor control is useful treatment in 72. The strength improvement only in 33. The attention is in 67. And the behavior regulation only in 20. And the spatial cognition is in 57. This data, we try to analyze this data after. Okay, discussion. Of course, but we have this system in this moment, and analyzing our data is more appreciation in the younger. Probably is due to that our children is used every day, is familiar with the smartphone, tablets, and so on. So the exercise is simple, and the older is probably they expect different ambience and more complex game. Of course, the type of disability, our data finds that the motor impairment is useful than the cognitive impairment. And inside the motor impairment, probably the balance and motor coordination improve more than the other. And in the cognitive problem disability, is attentional span and cognition of space is improved more the other. And we don't have a great result, of course, in our data in the behavioral regulation, because only 20% is useful. Then, in the conclusion, we have a great instrument. Of course, is a box, and we have to insert information in this box. So this is a flexible instrument. So it is important that the doctors, the physician, the physiotherapist, or the other person it's necessary that they improve the studies, because it's fundamental, it's very important to adapt this instrument to the babies. And this, that's all.
Okay, so thank you very much, Dr. Doglio, for
Sorry for my Italian English.
Don't worry. Thank you very much for your great presentation, because it's very important, the possibility to give all the interested expert like you are to join your experience as well. So thank you very much to all of you for your time, and see you on the next webinar. And what's about this next webinar? So I just want to explain you the next appointment of this NIRVANA webinar series. So the next appointment will be on October with the Dr. Alessia Fumagalli of the IRCA of Casate Novo, and she will talk about a new field of application of the NIRVANA, in particular in the respiratory rehabilitation. Then the following webinar will be in November with the Dr. Bissolotti of another important rehabilitation center here in Italy, in Brescia, and he will explain us their experience in using the system with adult patients with various neurological disabilities. And then we will conclude on December with the team of Nerolesi Hospital in Messina with the application of the NIRVANA system in the treatment of the autism spectrum disorders. And I'd like just to remind all of you that if you will join at least 3 webinars of this series, you will get also our certification as an attendant of this NIRVANA webinar series. Thank you very much again for your time.
Bye.
Thanks. Bye-bye.